Welcome to the December NHSN Virtual Learning Lab conference call. My name is Veronica, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. I will now turn the call over to Sarah Brinkman. Sarah, you may begin.
Thanks, Veronica. Hello, everyone, and welcome to our Virtual Learning Lab for December. This is our second Virtual Learning Lab for the month. We're so glad that you joined us. We're looking forward to starting this phase of data submission and continuing our work on this project, and we're glad that you've joined us today. A couple of housekeeping items to kick us off. We want to remind you of a number of resources that are available, including the slides for this call, which are available on the C. difficile page for the Lake Superior QIN website. There's a link for that page in the chat box if you're interested. We also, on that page, have a number of new resources, and we're going to be reviewing those today. We'll be stopping multiple times during today's call to allow time for questions over the phone, but please feel free to use the chat box throughout to ask questions, to ask for a step or a process to be repeated, or request that I slow down. This call is certainly for you, and we want you to help us to make it as useful as possible. And finally, as with all of our previous webinars, when you close out of today's event, you'll automatically be redirected to an evaluation, so please take a moment to provide us some feedback, and upon completing the evaluation, you'll receive a certificate of attendance for your records. So by the time we're done today, our hope is that many of you will have completed data submission for the month of November and possibly October if you haven't already. For those of you who aren't quite ready to submit your data, we believe you'll still find this webinar useful, as we'll be providing a live demo of how to submit your data within NHSN. As the objectives indicate at the end of today's call, you will know how to access your facility's NHSN account, check your facility setup within NHSN, and submit both C. difficile LabID events and monthly summary data. Before we jump into the presentation, one thing we wanted to note that NHSN does occasional updates to the system and may occasionally make a change in definition. NHSN sent out a notification regarding the delayed deployment of NHSN version 8.6. Please note that the updated version will only affect information and data submitted for calendar year 2017 and beyond, so data entered for 2016 is not impacted. We do just want you to note that you will not be able to enter any information for 2017, including your updated annual survey or any reporting plans, until after the new version has been deployed, which is scheduled for January 7th. We're going to be sending out reminders closer to that time as well, and also discussing this a bit further on our January virtual learning labs. So we hope that you'll join us for those to hear a bit more of those updates. NHSN has also stated that they are updating some of the protocols for 2017. Again, this will not affect the 2016 data entry. There does not appear to be any major changes related to the multi-drug resistant organism or C. difficile reporting, but stay tuned for more information as it's released. And finally, if you have not yet received your SAMS card, please continue to work with your state contact to complete the process so that you'll be able to fully participate in the collaborative moving forward. Okay. So, in terms of preparing for data submission, obviously before you can submit any data, you must have your facility fully enrolled in NHSN and have returned the signed participation agreement. And before you can submit any data, you must also map your facility locations and submit your monthly reporting plan, and we're going to review these two activities today. We also encourage you to add additional users from your facility to NHSN. Share the love, get some support from your colleagues. It's helpful to have more than one person who knows how the system works and ensures continuity of practice even if someone isn't available to do data submission on a given day. And you've heard from us many times about joining the required groups for the project. One is at the national and one is at the state level. Guides that walk step-by-step through this process are available on the Lake Superior QIN website, which we'll review in a moment. Finally, you have to collect the data before you can submit it, and you do this by following the NHSN protocol. So now we're going to review a few key points from the protocol. You know that you're reporting on C. difficile cases. More specifically, these are non-duplicate C. difficile positive laboratory assays obtained from residents receiving care at the facility. When you enter a case, it has to be linked to the specific location within the facility the patient was residing at the time of specimen collection, and only positive results from specimens collected from currently admitted residents should be reported. If the lab results were collected prior to admission, those cases should not be reported. You must monitor the entire facility, which is represented in NHSN by the phrase FAC-wide in. We know there's been a little bit of confusion from folks because of the in that phrase, which usually is just used to describe inpatient facilities, but NHSN is using FAC-wide in here to refer to surveillance facility-wide within long-term care facilities as well. There are a few definitions that we wanted to note. A CDI positive laboratory assay is a positive test result for C. difficile toxin A and or B, or a toxin-producing C. difficile organism that's detected in the stool specimen by culture or other laboratory means. And this is in comparison to what is being defined as a CDI LabID event, which is what you're entering into NHSN. A CDI LabID event is a non-duplicate C. difficile positive lab assay tested on liquid or watery stool samples and obtained while a resident is receiving care at the long-term care facility. And we had a question a while back that spurred some discussion and some back and forth with NHSN regarding the underlying statement here, liquid or watery stool sample. So the question was, what if a provider orders the test, even though he or she should not order the test because it's being done on a solid stool sample or a non-watery stool sample? And the answer here is that per NHSN, a documented formed stool sample is not appropriate for a CDI LabID event. So the key word here is documented. If it isn't documented that the stool was formed, the assumption should be that it was not formed. Most labs have a rejection policy in place and won't accept samples that don't meet the guidelines. If your lab has such a policy in place, you can assume that any positive results came from appropriate specimens. And if they don't have a rejection policy in place, we encourage you to have a further conversation with them about establishing such a policy. And you can use your state contacts for this initiative to assist you with resources to aid in that discussion if you wish. We also wanted to point out that this is a great opportunity to educate your staff and providers regarding proper testing for C. difficile, as well as potential treatment. If the patient's stool does not conform to the shape of the container, it should not be sent for C. difficile testing, and this is in order to avoid false positives and unnecessary treatment. A very important point to note is that you are only to report non-duplicate positive CDI lab events. So what we need to know here is, what is a duplicate? A duplicate is a positive C. diff result for a patient who had a previous positive within the last 14 days. We're going to walk through an example of this in a moment, but note that we do encourage you to add this information to your infection control line list or create a log of positive CDI results in order to be able to track on this aspect of reporting. So this is a nice short flow chart that lays out the process of determining whether or not to report. You receive a positive CDI test result, assuming that the sample was appropriate and conforming to the shape of the container. And at that point, the question you need to ask is, did this same patient have a positive result within the last 2 weeks? If yes, the case would be considered a duplicate and therefore should not be reported. If the answer is no, the patient has not had a positive result in the last 2 weeks, the case is a non-duplicate, therefore could be considered a reportable CDI LabID event. And this duplicate concept can be a bit confusing, so note that the definition of a duplicate does not say that the patient had a reportable CDI LabID event in the last 2 weeks, just that they had a positive test. So let's quickly take a look at this example. If the patient is tested on January 3rd and the result is positive, and the patient has not had a positive test in the prior 14 days, it is therefore a non-duplicate and should be entered as a CDI LabID event. 6 days later, the same patient is tested again and the result is positive. It's been less than 14 days since the patient was tested with a positive result, so this would be a duplicate case and would not be reported. The patient is then again tested on January 20th. This is 17 days after the first positive that was reported, but only 11 days since the last positive result. So this would again be a duplicate case and not reported. 9 days later, the patient's tested again, and although this is 26 days from the first test, it's only 9 days since the most recent positive in this series, and therefore is a duplicate and would not be reported. The final test in this example is from February 23rd, which is more than 14 days after the most recent positive test, making it a non-duplicate event that would be reported. I real quickly want to show you a couple of resources that you are maybe interested in. If you don't already have these pages saved to your favorites, we encourage you to do that. So if you bear with me for just a moment, I'm going to share my screen. And first we're going to take a look at the C. Difficile Initiative webpage on the Lake Superior Quinn website. So you can navigate here by going to lsquinn.org in your web browser. And then under Initiatives, we're going to choose Nursing Home Quality. And from the left-hand menu, we're going to select C. Difficile Initiative. You can see here that the resources are listed in the center of the page. So under Using NHSN, we have our C. Difficile Reporting Guide. We have our new Frequently Asked Questions for reporting C. difficile in NHSN. We have links to the first 3 webinars that we provided over the summer months to assist you with registering and getting enrolled in NHSN. The joining groups guides are available here by state. Remember that there are 2 groups for you to join, one at the national level, one at the state level. Our newest resources include short instructional videos, which mirror some of the information that we're covering today. So as you're going through the process, either later this month or in future months, if you, for example, in the first few months, if you don't have any CDI LabID events, and then you come across one, you might be a little bit worried about remembering how exactly to walk through that process. So the CDI LabID events video is, all of these videos are under 10 minutes long, and that will walk you step by step through that process. And then we have our future virtual learning lab events listed here, as well as slide handouts for this call and the other calls in this series. Along the right-hand side, you can find state-specific contacts for the initiative, as well as links to the SAMS and NHSN help desks, and links to NHSN resources. So the next resources that I want to review here is the NHSN Long-Term Care Facility C. difficile page. So I'm going to click on this link to take us there. So on the NHSN page, you can navigate to this site, although we do recommend that you save this for your future use specifically. And along the top, you can tell where you are by looking at the breadcrumbs. We're at CDC, with an NHSN, looking at materials for enrolled facilities, long-term care facilities, and specifically looking at C. difficile, MRSA, and other drug-resistant infections. In the center of the page, you can see the resources that are provided, and if you click on the chevron there, it will load those. So these are all of the training resources that are available. These are the protocol resources. We do recommend, if you haven't already, that you print a copy of the protocol as a desk reference. The data collection forms, which we're going to talk a bit about more, as well as the tables of instructions that go along with each of the data collection forms. Additional supporting materials, including the location labels and location descriptions for mapping your locations within NHSN, and some general FAQs, as well as other resources to help prevent infections. So our next step here is that we're going to jump into logging into NHSN. But before we do that, I want to just take a moment to check to see if there are any questions, either in the chat box or over the phone. Veronica, could you give instructions for how folks can ask questions on the phone?
Sure. We will now begin the question and answer session. If you have a question, please press star then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. There will be a delay before the first question is announced. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touch-tone phone.
Great, thanks, Veronica. And Christy has confirmed for me that there aren't any questions in chat. So at this point, if we don't have any questions over the phone, we'll keep moving along. Again, please post your questions in chat as they come up, and we're happy to address those. So next we're going to walk through the process of logging into NHSN. So here we're at the login page. The web address for this was provided in the slides. It's sams.cdc.gov, or you can Google CDC NHSN login, and it will take you to this page as well. Once you have your grid card, you will always log in using the SAMS grid card option. So we'll click that. And then again, under the SAMS grid card, this is where you'll enter your username and your SAMS password. On the next page, you'll be asked to enter your grid card credentials by finding the letter or number that corresponds with the column and row that are provided. And then from the My Applications page, once you've completed enrollment for your facility, you will always choose the NHSN reporting option. Now, for many of you, the page will automatically take you to your facility's profile because you only have access to one facility and one component within that facility. If you have access to more than one facility, you'll want to choose long-term care facility from the component drop-down list and then select the facility that you're interested in reviewing. So that takes us through the login process. Just give me one moment here. So now we're in the facility profile. We're going to walk through the steps to check facility setup. It's a good idea to check your facility location mapping before entering data to make sure that it's current. And if the same person is continually submitting the data, it may not be necessary to do this every month. However, reviewing the location mapping can be particularly useful for new NHSN users at your facility. So assuming that you've already mapped locations, you can review them by selecting Facility from the left-hand menu and selecting Locations from the Facility submenu. You'll see at the top that there's a set of instructions based on which action you would like to take. So to add a record, to find a record, edit, delete, etc. In this case, we want to find what locations have been mapped. So we're going to click Find at the bottom, and this will generate a list of all the locations. So I'm in a test facility, and you can see that there are a number of locations that have been mapped here by a variety of different users. Your facility may only have one location. It may have multiple locations. What's important to note is that the facility location mapping there's some requirements set forth by NHSN with regards to how detailed you need to get in the breakdown of your units, and those are provided in greater detail on the long-term care facility page for CDI. But it's also important for you to note that the more granular you get in the breakdown of your description of the units, allows you to be able to see data on the back end when you run reports. So if you have only general nursing in your facility and you decide to only map to one location within your facility, you won't be able to look at those reports that are generated by NHSN later on to see where you might have some opportunities for greater infection control based on the breakdown of infections within your facility. So do think about that when you're mapping. If you need to edit any information for a location, you can do so by clicking on the hyperlink that is listed under your code. So in this case, if I want to edit any information for 1 North, I can click on that, and then you can see that up above the information in the fields becomes editable. So I can make changes to these as necessary. For example, if I need to change the bed size, or if the location description is no longer applicable and this general nursing unit is now more appropriate to be labeled as a dementia care unit or a psychiatric unit, what I would actually need to do is make the unit inactive and then add a new unit with that new location description so that the data that's already been collected for that doesn't get changed based on the unit change. After you make any changes, of course, you need to click the Save button. So if you haven't mapped your locations yet, let's just get to a clean list here. We can hit Clear, or we can go to Facility and Locations again, and it will reload the page. Now you could enter your code, which is what you want to call the location. This is a 10-character field, so if your location is, for example, Golden Meadows, the entire name isn't going to fit in this Your Code box. You might need to abbreviate it. Your label can be the same as your code, or it could be more detailed, so you might want to write out the name in full if you haven't been able to already. Then the CDC location description is meant to describe the type of care that's provided on that unit to 80% or more of the patients or residents. Leave the status at active and enter the bed size, and then click Add. So that gets us through locations. Now I want to review quickly how you go about adding a reporting plan. So on the left-hand menu, again, if you choose Reporting Plan, and then from here, if you believe that you've already entered your reporting plan or you want to check to see what reporting plans have been entered, you can click Find. And if you click Find again on this page, it will again generate a list. And remember that I'm in a test facility, and so this is generating a list of all of the monthly reporting plans that have been entered for this facility. At this point in your experience with NHSN, your list is only going to be 1 or 2 months long, most likely, and won't roll over into years. But a couple of things to note about this page. It is limited at first to 10 entries. You can click on that drop-down list and extend it to 100 entries. You can also change the sorting methodology by clicking on any of the headers. So right now you can see that it's all of the Januaries, year by year, month together, all of the Februaries, and so on. If I want to see it year by year instead of seeing it all of the months lumped, I can click on year, and now it's January through December 2015, January through December 2016. And I point this out because as you go on, this is useful to note. It's also how the process works on almost any of the pages within the NHSN application, that you can change the sorting methodology, that you can expand the number of entries that are available to see within a list, and that you can just click Find to generate a list of all of the related reports that you're interested in looking at. So in this case, we're going to be reporting November 2016 data. I can see that someone's already submitted a monthly reporting plan for this month. So I can click on the hyperlink, and it will show me what's been submitted. And I can see that right now it says that for November 2016, I'm planning to submit on C. difficile. If I needed to edit anything on this page, I could click Edit, and it would make the fields editable. I can make the necessary changes and then click Save. In this case, I'm going to go over here, and if you haven't already submitted a monthly reporting plan, you can click Add under the Reporting Plan submenu. And then again, you'd click the month and the year that you're interested in reporting. If you're only reporting on C. difficile, you're going to be working specifically within this LabID event module area. You'll leave your locations defaulted to facility-wide inpatient, which is the only option. The specific organism type would be C. difficile. You'll note that this checkbox auto-populated when I chose C. difficile from the drop-down menu, and you'll leave that checked, and then you'll click Save. Some facilities choose to enter all of their monthly reporting plans for a calendar year at the same time. You can enter them so long as the annual facility survey for that year has been submitted. So you can go through that process either by selecting the month and year from the drop-down list and then indicating what you plan to submit, or you can choose the month and year from the drop-down list and click on this Copy from Previous button to pull the monthly reporting plan forward from month to month. So that gets us through our facility setup as well as the monthly reporting plan. Just want to take a moment to check in to see if there's any questions in the chat box. No questions. Great.
Wait a minute, I have a question.
Sure.
When would you do like add row?
So that's a great question. So the LabID event module doesn't just cover C. difficile. You can also track on CRE, MRSA, VRE. So say in this case that your facility decides you've gotten familiar with NHSN, you know how to track C. diff, and now you're interested in also tracking on, well, this isn't going to let me do it. On MRSA, you could click to add a row. So another feature that I just want to point out, and this is true of a number of the applications that you'll find within NHSN, once I'm in here, if I select November 2016, remember we already checked and we know that a monthly reporting plan has been submitted for the month. If I choose November 2016 from the drop-down list, the page will repopulate and show me that it's already been submitted, and then I'll have the option to edit. So you can't by mistake, enter 2 monthly reporting plans for the same month. If you have more than one user at your facility, or if you forgot that you had already submitted it, NHSN will let you know, hey, you've already told us what you're planning to submit. If you want to submit more information or change what you told us, you can do it by editing what's already been submitted here. So now if I were to click Add Row, I could choose MRSA from the drop-down list and click Save, and also add that into my reporting plan for the month.
Okay, so if you discover that you made a mistake when you submitted something, you would need to go back in here.
So it would depend on what the mistake was. If the mistake was something that you added in terms of summary data or event data for a C. difficile case or your monthly summary data, you would do that within those specific applications on the left-hand side. If you accidentally indicated that you did want to track on MRSA, and then when you went to submit your monthly summary data said, no, I don't want to track on that, you could come back in here and edit your monthly reporting plan. So it depends on which phase of the process you're in. Okay. Any other questions? So now we're going to go on to entering some CDI LabID events. So from the left-hand side, you're probably getting used to this now. You're always going back over to the left, and from here you're going to select Event, and then you're going to select Add to add a new event. You can see that NHSN is popping up a warning saying, are you sure you want to leave this page? And that's because I made some changes to the monthly reporting plan here, but I didn't click Save. So this is their way of catching me to make sure that I save my work as I go along. We don't need to save the example that we were looking at, so we'll click Leave this page, and it will take us to the Add Event page. So now that we're on the Add Event page, we're going to walk through a couple of examples today. One in which we're reporting an event for a resident who's never had a previous event entered in the system, and another for a resident that has had a reportable event in the past. So we're on the Add Event page, and you can see at the top that it's asking us for resident information. The facility ID is defaulted to be your facility, and the first field that you'll be entering is the resident ID. This should be a unique number that will stay with the resident. Your facility might call it a resident number or a medical record number. Do not use your room number or bed numbers, as these change over time. In this case, our resident ID is going to be 8538555. So you can either click to the next field, or you can hit Tab to take you there. In this case, this resident has never had a case entered into the system, so I'm always going to get this pop-up message if this is the case that says that we could not find the resident. You can directly enter a new resident from this screen, and in that case, I'm just going to click OK. The next field is Social Security number. This is a required field. If your facility does not want to enter Social Security numbers in, or if you don't have access to a Social Security number, you can put all 9s in the field, as I've done here. The next few fields are optional, so last name, we're going to go ahead and enter the patient's name in this case. Gender and date of birth are required. When you're entering dates into NHSN, do not enter the dashes, just enter the numbers. So in this case, I'm going to do April 16th, 1942. And note that I didn't hit any dashes. It auto-populates that for me. If you try to enter the dashes, you'll get an error message. And then ethnicity and race are also optional with regards to how you would like to track on your event. Resident type is going to ask you to distinguish between short stay and long stay residents. So short stay being those residents that have been in the facility for 100 days or less, and long stay being residents that have been in the facility for more than 100 days. In this case, Meredith is a long stay patient. The date of first admission to the facility is exactly that, the date that the patient was first admitted. It is important to note here that if the patient was admitted and then left the facility for 30 or more consecutive days and was readmitted, the readmission date would be the date of first admission. So this could happen in a number of circumstances, but in particular, we find that this is common among your rehab patients who may have come in, stayed for quite some time, and then left, and then come in maybe a year or two later for something else. So that's the date that you'll want to be selecting here. So we're going to say that Meredith was admitted last December 7th, 2015. Date of current admission to the facility is if the resident has left the facility for 2 or more consecutive days, but less than 30 consecutive days, and then come back. So these would be most likely, in many cases, your acute care transfers. If you have a resident that goes to the hospital for a week and then comes back, the date of current admission would be the date that they came back. So in this case, we're going to say that Meredith was in the hospital at the beginning of November and came back on November 14th. Then scrolling down under event type, you're going to choose LabID event from the drop-down, and it will load the remainder of the questions that NHSN is going to ask you for this specific case. So we're looking at November cases, and in Meredith's case, her date of the specimen was collected on November 21st. The specific organism type, we're going to choose C. difficile, and that will auto-populate the answers for the specimen body site and the specimen source. Resident care location, you're going to click here, and this will show you the list of locations that you've mapped for your facility. You're likely only going to have 1 to a handful of locations to choose from. Again, this is a test facility. I have a lot of them here. Pardon me. I'm going to choose 1 north. And the primary resident service type is going to, again, align then with those location types that you studied earlier. So what type of care was the resident receiving? In this case, Meredith was a general nursing patient. Has the resident been transferred from an acute care facility in the past 4 weeks? We said yes, that actually she was recently transferred. And note that this question is asking in the past 4 weeks. What it has to do is in the 4 weeks previous to the date that the specimen was collected. So it's December 19th. It's been more than 4 weeks since she was transferred, but we're entering a case where the specimen was collected on November 21st. So she was transferred just 1 week prior to that. The date of last transfer from acute care to our facility is again going to be that November 14th date. And then the final question is, if yes, was the resident on antibiotic therapy for this specific organism at the time of transfer to your facility? We're going to select no in this case. The remaining fields, the documented evidence of previous infection, this is an NHSN only field, so they will populate this as necessary based on the information that you provide. The custom fields and comments are there for your use if you would like to use them. They will not be analyzed by NHSN. And then at the bottom, we would click Save to enter our case. You can know that your case was successfully accepted when you see this green checkbox at the top with the note, there will be an event number, and then it will let you know that it was created successfully. The second case that we want to review is supposing that the resident has already had a case entered into NHSN. And so in this case, we're going to say that the resident ID is 9528553. Now when I click tab, oops, I did that wrong, 8533. Now when I click tab, you can see that the resident information populates. So NHSN has saved this information, and the reason is that John Smith had a previous case that was more than 14 days ago and entered into the system. So we don't have to re-enter any of the resident information. We also already have his date of first admission and his resident type we need to indicate here. So we'll call him a long-stay resident. His date of current admission to the facility is going to be the same as the date that he was first admitted. So that will be 10/12. Whoops. 10/12. Why is it doing that? I didn't, so isn't that weird? Sometimes it just is picky. 2015. The event type, again, I would choose LabID from the drop-down list. And the specimen was collected. In this case, we're going to say that his was collected on November 24th. Specific organism type is C. diff. The resident care location is going to be 1 West. The primary service type will be general nursing. And in this case, our resident has not been transferred in the past 4 weeks. So that's the extent of the questions that I need to answer for this particular case. And I'll click Save. And now you can see it moved up 1. I've now entered event 7841 has been created successfully. So those are 2 examples of event IDs to enter into the system. The final step in your process of submitting data is to go to the summary data on the left-hand side here, and then click Add. From the drop-down menu, you'll select the month and the year that you're interested in adding. So in this case, if I choose November 2016, the page populates, and it now only shows me the information that I submitted on the monthly reporting plan. So because I didn't indicate on the monthly reporting plan that I was planning to track on urinary tract infections or prevention process measures, I'm not able to enter that information on this screen. I'm only able to enter information under the MDRO and CDI LabID event reporting section. And you can also see on my screen that the C. difficile box is checked, and that's because of those MDRO and CDI LabID event reporting options. I only selected C. difficile to report on. This is where you'll enter your total resident admissions for the month, your total resident days for the month, and of the resident admissions, how many of them were on C. difficile treatment. This is also where, if you did not have any cases, CDI cases, to submit for the month, you'll check this box here. If I had not entered any LabID CDI events into the system, there would be 2 red asterisks here to remind me that I needed to indicate to NHSN that I didn't just forget to submit data, that I didn't have any data to submit. And once you've submitted your entered your monthly reporting data, then you would click Add at Save at the bottom, and you would be done with your data submission for the month. So at this point, I just want to show you real quickly on the front page, when you first log into NHSN, it takes you to this alerts page. And on the alerts page, many of you will see that it says you don't have any alerts. In this case, in my test facility, I have a number of alerts. I have 6 missing summaries. So if I were to click on this hyperlink, it would take me to a list of all the summaries that are missing so that I can go in and correct the issues. The most common errors that we'll see for the C. difficile initiative are that you didn't enter your monthly summary data, or that when you entered your monthly summary data, you failed to indicate that you didn't have any LabID events for the month. So when you first log into NHSN, we always recommend that you check this box to see if there are any issues. It will also help to remind you of what you told NHSN you were planning to report. So if you submit a monthly reporting plan, and by a certain point into the next month you haven't submitted that data, it will pop up in here to say that you're missing an entire month's worth of data because you told us you were going to submit on CDI, but we haven't gotten that data from you yet. So that reporting plan does feed a lot of other features within the system. So now I think we're going to just open it back up for questions. So I'm going to stop sharing my screen and advance towards the end here. So once you've done that, as I said, you'll have submitted your monthly report, your data for the month. Many facilities have shared how easy this is in comparison to the enrollment process that you all went through. So hopefully you'll find that this is relatively straightforward and you're able to get the information that you need from your business office in a timely fashion to be able to enter your data within a week or 2 of the beginning of the month. So at this point, I'd like to open it up for questions. Veronica, could you give instructions on the line again?
Sure. If you have a question, please press star then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. There will be a delay before the first question is announced. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touch-tone phone. Standing by for questions.
And as you're thinking of questions, or if you have any, if any of you have submitted your data and want to share what your experience was or anything that you've run into, we welcome that as well. We also encourage those of you that haven't submitted your data yet, if you have your grid card available and your data for October and or November, to go ahead and log into NHSN right now while we're on the phone and able to address any questions that you might have as you walk through the process. But if there is anyone on the line who's gone through the data submission process and has any feedback or any insights on how it works, we'd welcome you to share that as well. Again, it's *1 on your phone, or you can type directly into the chat box. How do you calculate resident days? So resident days, if you were to look at there's a form that NHSN has available. Let me pull that up real quick here. I'm going to go to share my screen. So on the long-term care facility page, there's data collection forms available. There's templates available. There's the LabID event form, and then there's also the denominator form. These two forms in particular we think you'll find useful, as well as their related table of instructions. So if we open the denominators form, which is essentially the monthly summary data, you can see that what they've provided is a list of dates for the month, so the dates run along the left-hand side through 31, assuming that it's a full month of 31 days. And then there's column headers for number of residents. These two columns right here have to do with urinary tract infections, so unless you're tracking on those, you don't need to track on that information. The number of total admissions and the number of admissions on C. diff treatment. So literally what you would be doing is every day you'd be calculating the number of residents that you have in the facility, and then at the end of the month you'd be adding the total up. What I'd like to point out is a number of your electronic health record systems, your business offices, and so on have the ability to calculate this number for you, and you probably don't need this form. But what I do think is particularly helpful is the table of instructions. The table of instructions goes field by field through what you see both on the template form as well as in NHSN when you're filling in the monthly summary fields, and gives you a definition. So number of residents definition. For each day of the month, record the number of residents in the facility. Do not include residents for whom a bed is being held but are not actually present in the facility. And then you'll total those up to come up with your total resident days. The same is true of the LabID event form. So if you click on the table of instructions for the LabID event form, it goes field by field through what you see either on the template form or in NHSN and gives you a definition of each of the fields. So the first fields are pretty straightforward. They have to do with the resident demographic information. So as you scroll down, when you get to resident type, if you can't remember the difference between short stay or long stay, or if you're confused about the 30 days of consecutive time outside of the facility for the date of first admission, you can read the definitions here and they will assist you in determining the correct answer. Maria, does that help answer your question? Great. That was a great question. Other questions? If you've already submitted your data, can you please let us know in the chat box how that process went for you? We have one other question here. Karen Post has asked, if a patient is readmitted to long-term care after a hospital stay with diagnosed C. diff and being treated, do you count it in the number of admissions? So Karen, what I think you're asking is that the patient has left the facility and come back, we're assuming more than 2 days gone and less than 30 days gone at this point. So you would count them as an admission. And if they're on C. diff treatment at the time that they return, you would count them both as an admission and in the number of admissions on C. difficile treatment. You would not enter this as a C. difficile LabID event because it wasn't identified while the resident was in your care. Does that answer your question?
But what if you do another test after 2 weeks of them being in your facility?
So if you do another test and it wouldn't even have to be after 2 weeks in your facility. If it's the first LabID event in your facility, then you would have to submit it.
Okay.
So you would need to look at your testing protocol and make sure that you're following that, because you don't want any unattributable C. diff cases being counted against your facility if the resident is already identified as having C. diff in your facility. You would want to check your protocol to ensure that you should be testing them within that short period of time.
Yeah, and you probably wouldn't want to test them. That's the lesson here.
Yeah, in that case.
Right, because you already know they have it.
Correct.
And if it seems to resolve and they're having formed stools, you would not test them.
You would not test them. No, you shouldn't test unformed stools ever. Thanks, Karen. That's a great question. I will note it's been confusing for some folks. They want to know where they're supposed to put the numerator number. Where do I say how many CDI LabID events I had? You don't actually ever put a number in. You enter the LabID events in per that page within the NHSN application, and they calculate your numerator based on the number of CDI LabID events you submit. Great questions. Are there folks that are working on submitting their data or who have already submitted data for October or November? And again, if you want to share with us, you can press star and 1 on your phone. So at this point, what we're going to do is we're going to stay on the line. So Veronica, we want to keep the line open. We don't want to end the call yet. But if you've already submitted your data, or if you aren't going to be working on submitting your data right now, we want to thank you for joining us. We are going to stay on the line for the next 10 minutes or so that those of you who are working on submitting your data can ask us questions in real time. So feel free to use the chat box or press star 1 to ask your question over the phone. For the rest of you who will be dropping off the line, when you click out, remember that there will be an evaluation, and we'd greatly appreciate your feedback so that we can dedicate new time to new resources for you or to improve future offerings.
We do have a question.
Yes.
I have a question from Karen. Go ahead. Your line is open.
Thank you. I'm a little bit confused on the resident admissions.
Okay.
That would be the total admissions for the facility for that month, as well as the readmissions that are gone longer than 2 days.
Correct. So,
facility?
Yep. So I'm going to share my screen again. That's a great question, and one we've gotten before. So if we go back out to the long-term care facility page, and again we click on, let's see here, we're going to go, sorry, can't get out of there. Okay. So on the long-term care facility page, we're interested in more information about how to calculate the resident admissions. So we're going to click on the table of instructions for the denominator. If we scroll down, the number of admissions for the facility is defined as, for each day of the month, count and record the number of residents admitted to the facility, include both new admissions and readmissions.
So readmissions, they'd have to be gone longer than, or just like out over midnight, like a day. Is that what you're counting as a readmission, or there's no specific gone more than 2 days or a day?
There's no specific definition for that I'm aware of. So in the field where you're asked to put, when you're in the actual case itself, when you're looking at the date of first admission versus date of current admission, the date of current admission is that they have to have been gone for 2 calendar days. And that lengthier definition is provided here. But readmission to the facility would be based on your facility's definition of readmission.
Okay.
Does that make sense?
That makes sense. And then as going the number of admissions on C. diff treatment, that would be, like they're diagnosed in the hospital, they come back to long-term care facility, then that would be counted as a 1 if we just had 1, right?
Right, and so you would count that patient both as an admission, or that resident both as an admission and as an admission on C. diff treatment. So yes, most often those are going to be your acute care transfers. It's possible that you have a resident coming from the community that's on treatment for C. difficile.
Right. Okay. No, that's clear now. Thank you very much.
Great, absolutely. And it was just pointed out to me, and I owe everyone an apology. I don't know how we didn't catch this before, but I am going to go back up to where we were talking through, let's see if I can find it here. Thank you. So for the C. diff cases, for the duplicate cases, we have an error here on the screen. So when we talked through this, remember we said that this case on the 23rd of February should be entered as a LabID event because it should not be a duplicate. So the center field where it says duplicate, yes, that's incorrect, and that's an error on our part. I apologize for that issue. We'll definitely correct that. You would not enter it if it was a duplicate. The reason it isn't a duplicate is that it's been more than 2 weeks since the last positive test. So apologies on that. We'll work to make sure we get the right answer out there. We still have a number of participants on the line, so I'm assuming that means that you're working on submitting your data while we're here, which is fantastic. So we're going to stay on yet for until the top of the hour. Please feel free to queue up by pressing *1 or type your questions into the chat box. All right, this is the last call for questions. If you do have any questions, if you want to type them into the chat box or press *1 to ask them over the phone. As a reminder, your state contacts are always available to provide you with assistance as you're working through this process, so please don't hesitate to reach out. Are there any final questions on the phone?
We have no questions at this time.
Thanks, Veronica. Great. So as you are finishing up your data submission for November and October, please don't hesitate to reach out if you do have questions. And when you close out of the WebEx, please do take a few moments to answer our short evaluation and provide us with feedback. If you have suggestions of ways we could better support you in this project, please let us know. Thanks, and have wonderful holidays. Oh, we have a question?
Yes, one just queued up right now. I'm sorry.
Great. Thank you. That's okay.
It's, Karen, go ahead. Your line is open.
This is actually Cindy. I'm here with Karen. You know, when we got the actual survey thing came up when we exited, it says that the survey is closed and will no longer accept responses, just so that you know you're probably not going to get very many.
Well, that was an error on our part. We'll follow up on that. Thank you for letting us know.
Okay. Yes, no problem.
All right. Well, we do encourage you to email us if you have suggestions or feedback. We'd love to hear from you. Sorry that the evaluation isn't working correctly, and we will work to get out a certificate of participation out to everyone who was logged in today. So if you are participating with more than one person from your facility on one login, that is just a general certificate that one person will receive, and you can print out duplicates for your for anyone from your facility that was here on the call. And with that, we'll wish you a happy holiday season, and we'll be in touch in the new year. Thanks so much.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.